Thank you for joining us today for the Mentor Health IT Program information session brought to you through the Lackey Pearl Health Network. The Mentor program was funded through a federal grant from the U.S. Department of Health and Human Services, Health Resources and Services Administration. This grant was awarded to the Lackey Pearl Health Network to partner with organizations across Minnesota to provide training in health information technology specifically geared toward rural needs. Lackey Pearl Health Network has partnered with experienced health IT trainers at Normandale Community College to deliver this customized training. We named the program to be reflective of these partnerships, so Mentor Health IT stands for Modeling Effective Network Training Opportunities for Rural Health Information Technology. The Mentor program was funded to provide health information technology training for 30 to 40 individuals each year from 2013 to 2016, or 120 in total, across rural Minnesota. After the training portion is done, an unpaid apprenticeship will help trainees apply what they learn to a real-world setting to solidify and synthesize the concepts they learn. Trainees will be able to sit for a number of industry credentialing exams, and if they're unemployed, we have resources in place to help them with their job search. The goals of the Mentor Health IT program include an increased understanding of health IT across and within all departments, more efficient systems, workflows, and operations within a facility, empowered employees to be more effective and productive in the work they do with increased confidence, and working in an environment that is heavily driven and managed by complicated IT systems, vendors, mandates, and constant change. Equip facilities with in-house expertise on meaningful use requirements, quality metrics, coding changes, mobile and telehealth, data management, and much more. And we hope to create a nationwide model for rural health IT training. Let's pause just a moment to clarify what we mean by health IT, since this terminology varies widely among employers across the industry. Here is some information to help clarify some of the commonly recognized differences between health information management, health information technology, and health informatics, and how these three areas complement each other. The best way to frame this subject is to first look at health informatics as the scientific discipline that ties everything together. It's at the intersection of information science, computer science, and healthcare. Health information management mainly focuses on the medical record and managing patient or individual-related data, including validating diagnostic codes, and is mainly responsible for the entry, storage, and accuracy of medical information. Health IT, which is also known as Healthcare IT or shortened to HIT or HIT, refers to the management of health information systems with the technological tools used to store, share, and analyze health information in a safe and secure manner, and the analysis of how people use these systems. HIT professionals often perform IT roles within a healthcare setting, but are not always working in an IT department. Since these terms are often used interchangeably, it is sometimes necessary to clarify what someone means when they're using these terms. For the Mentor program, we are working in the HIT and health informatics space, covered by the blue oval shown here. For participants, the program starts with health IT training. Anyone working in healthcare can take this training. It's not just for IT employees. In fact, we hope each facility can have several of their employees from across their organization take advantage of this opportunity, and we'll explain why in a minute. This program is also open to recent graduates of healthcare or IT-related academic programs, unemployed, underemployed individuals, or veterans. So if you're hiring for any position, you might consider having new staff members take this training as part of their onboarding process. The overall purpose of the program is to upskill the workforce and keep rural healthcare facilities competitive, solvent, and sustainable. As you can see here, when a wide variety of staff are trained in health IT, it can have a significant positive impact to the organization's bottom line. The specific training certificates that are offered through the Mentor program are listed here. Trainees select one of the certificates offered when they register. A schedule of offerings will be covered in an upcoming slide. At this time, there's no restriction on one person completing more than one certificate. However, a separate application must be submitted for each session. And due to the time commitment, only one certificate may be taken at a time. The Informatics and Technical Support Certificate will cover similar topics, although the actual content will be customized to the focus on the certificate in which someone is enrolled. The Informatics Certificate will focus more on the people and how they use technology, and the Technical Support Certificate will focus more on how to support these systems and working more with vendors. The Health IT training professional will cover some of the same core concepts, but we'll get into how adults learn and the most effective way to train them. It will cover adult learning principles and training and design methodology, and trainees will learn to design training for Health IT system users utilizing interactive teaching concepts designed to enhance acquisition, comprehension, and retention of material. The Health IT Analyst Certificate, again, will target the more advanced skills required to analyze data and improve the integration of systems. It takes the training people went through in one of the previous 3 certificates to an even deeper level and prepares trainees to support organizations through the optimization of technology to improve care delivery. Trainees will gain professional skills in an exciting new field which can be applied directly to the work they do every day. They will gain Health IT industry experience through the apprenticeships and hands-on experience using a variety of technical systems and the skills they need to apply that knowledge to any system they use. We are using a couple of vendors' electronic health record systems, so trainees can see exactly how to apply the concepts to a system they may be familiar with. However, the concepts are very much transferable to any system. Upon completion of the training, trainees are eligible to sit for industry credentialing exams and may become eligible for career advancement opportunities at their organization. Each certificate will take approximately 6 to 10 months to complete, depending on how much time is invested by the student. It is completely online, self-paced, and instructor-facilitated with group interaction and hands-on lab experience. Trainees should expect to spend around 7 to 10 hours per week on the coursework. This includes all online lectures, assignments, lab work, and exams. Since it is self-paced and available at any time, training can be done anytime it's convenient for the trainee. Employees who wish to use work time to do all or part of the training should get prior approval from their employer. Because organizations should see an immediate positive impact to their business as a result of employees going through this training, we strongly recommend that employers allow their staff a few hours each week during already existing downtime to do some of the training at work. We've seen that when employees are allowed to do some of the training during work hours, they feel empowered to continuously improve themselves and bring these knowledge and skills back to their organization, which has invested in them. CEOs in the region have told us that most employees have some downtime during their day, so we're not suggesting that they should be given more than that amount of time at work. However, trainees will be required to spend some time outside of work to successfully complete all of the training, so it is a true partnership, and everyone has some stake in the game, so to speak. On average, the amount of time it would take for someone to complete the training is 7 to 10 hours per week. Since it is free, and trainees could theoretically complete it all on their own time, there is no actual requirement that employers must approve the training for their employees. However, we've seen that people who try to complete the training entirely outside of work hours struggle quite a bit with the time commitment and are less likely to complete the program. The training program runs over a time frame of 3 years. The first year started with the Informatics Certificate in April of 2014, and it ends this upcoming January in 2015. In January of 2015, the Informatics Certificate is offered again, as well as the Technical Support Certificate. Then in Phase 3 of the program, starting in September of 2015, the Trainer Certificate will be held and the Upper Level Analyst Certificate, which is for people who are already working in HIT or have completed one of the prior certificates. After the training portion is done, an unpaid apprenticeship will help employees apply what they learned to a real-world setting to solidify and synthesize the concepts they learned. Although an apprenticeship is not required for every trainee, it is a unique opportunity to apply the new skills to the real world and gain valuable experience. We have designed an apprenticeship toolkit, and the mentor program staff are available to guide trainees and host sites through this process. Apprenticeships are not paid through the mentor program, but are also not intended to take more time each week than the training itself. They should be able to be completed in 80 hours or less, over about 8 weeks, and they can be completed at an employee's own facility or another one. There are 3 parts to the apprenticeship: shadowing various departments to document workflow and experience how technology is used in each area, a project which can be customized to suit the trainee's interests and benefit the host site in some way, and a capstone summary of the experience at the end of the apprenticeship. Also, upon completion of the certificate training, trainees are well qualified to sit for credentialing exams. Since the federal grant required us to customize the curriculum to meet rural needs, the Mentor team has been working directly with credentialing organizations to align the training to these certification exams. Health IT Certifications has the Certified Professional in Electronic Health Records and the Certified Professional in Health Information Technology. The Health Information Management Systems Society, or HIMSS, has the Certified Associate in Health Information Management Systems, or KHIMSS. And the American Health Information Management Association, or AHIMA, has the Certified Health Technology Specialist in Practice Workflow. We are currently working with our team to see if the Mentor program can cover the cost of these exams, but at this time it is not guaranteed. And finally, for unemployed individuals, the program has built-in support for helping them make the transition to gainful employment. Here's a snapshot of the Mentor team and our partners. When candidates are ready to apply, they should gather some items to be prepared to fill out the application, since they're only allowed 45 minutes to complete the online form. They should have their resume or work history ready, as well as their employer information. They will be asked to describe why they are interested in the training program and also to explain any obstacles they foresee to completing the training. Once they are prepared, they can go to the address listed here and click on the link at the bottom of the screen to access the application. Applications are rated and candidates contacted as to their approval within 1 week. Any questions can be directed to the people listed here. Thanks for joining us today.